the pain check really has a positive impact to the quality of care of the residents in terms of providing this efficient and effective way of pain management. It's actually helping us providing an efficient quality care for the residents. I know one of our priority is providing comfort for the resident. We've got a gold standard frameworks here, which is helping us as well, providing end-of-life care for the residents. So managing pain for those residents who are at end-of-life stage. We're also using pain check with that regularly every day, and it really helps us reducing or elevating the comfort of the resident.
So since using pain check, we have seen reduction in falls in the home, reduction in hospital admissions. We've seen, of course, the management of pain itself in the way of the severity of pain. The level of pain is much more in line with a system that is quite reliable instead of something that's quite subjective, for example. So in that, it brings that confidence in managing people's care.
So one of the things that we've noticed by using pain check, particularly in relation to identification of infections, is that when somebody is starting their brewing an infection, they tend to behave slightly differently and they may well have pain at that time. If we think about somebody who perhaps has a urinary tract infection, anybody that's had a urinary tract infection knows that it's uncomfortable and can be excruciatingly painful. If we can nip that in the bud early by identifying that the person's starting to get a little bit uncomfortable and that they may need treatment, then we can give that evidence to the GP and get treatment for them earlier. Clearly there's an element of how do we prevent that in the first place. But what we have found is that people who are treated well for their pain, and I think also about respiratory infections, we all know that if we keep on having a hacking cough, then it's likely to cause us a lot of pain. But it also becomes a cycle where you're coughing and coughing and coughing and it hurts. I mean, you know that you shouldn't be coughing, but you need to cough. Then treating that pain that's caused by the coughing will actually help that person to settle better and help them to fight the infection better. So I think it's a side part of using pain check that we hadn't anticipated, that we would be able to identify the symptoms of infection much earlier, treat those infections, and therefore improve the quality of people's lives.